Hi, I'm Dr. Shruti Tannan. I'm a plastic surgeon.
Hi, I'm Kristie Foushee and I'm a registered nurse injector.
We have a really unique approach to treating the jawline, and it's where we're able to synergistically work together and take advantage of our expertise to give you the best of non-surgical and surgical options. So Christy, I want you to start. Can you explain to me what are the different options we have to make that jawline sharper when it's starting to get saggy and obliterated?
So there's a couple of different approaches that you can take. Botox is a really good option as far as treating your platysma, which is a depressor muscle. We can treat it here, which actually gives you a little bit of lift, and they call it the Nefertiti lift. Something else we can do is jawline filler. We can do chin filler. That helps give you more projection in the front view.
I like how I want to brag on you for a second. I like how Christy does a really nice job putting filler in that little hollow just as you're starting to get a jowl, where people will come to me and be like, they're in their 50s and they'll say, Dr. Tannan, I need a facelift. And I say, well, I see the problem, but a facelift is like, taking a Mack truck to a small issue. So I think that's a really nice way to kind of hold people off and push off surgery to the future. I didn't mean to interrupt.
That's okay. Something else we can also do is treat the masseter muscle, which will give you a little bit of definition in the back part of your jawline, and it makes it look sharper.
It does. It really feminizes your face as well. You've been doing that for me, and I find it super helpful for grinding, clenching for our patients, especially with, stressful times, and it enhances your look.
And let's not forget you do mine.
I do. There's some other things that you do, Christy, that I really like. For example, when you do Morpheus, can you explain how you use Morpheus for a jawline?
So you can address the jawline with Morpheus because you can actually go deeper in that area because the tissue is thicker, and we can customize the settings so we can go deeper and increase the energy to a level that you can tolerate, but it also will help decrease some of the fat and tighten the skin in that area. But if we were to do that, we would do the Morpheus first and then do your fillers second.
That's a really good point. Why is that?
Because we can actually dissolve the filler by doing Morpheus because the radio frequency is going deep enough that it can actually melt or take away the filler that's there, and we wouldn't want to waste your hard-earned money.
That's right. That's right. And that's why we plan it out in advance. And when Christy feels like she's not able to help with non-surgical methods, that's where I come in. So she'll, half the time in clinic, you'll see one of us go into the other person's office or exam room to say, hey, I want your opinion on this person. I want your expertise, because sometimes Morpheus isn't strong enough to completely redrape and resuspend the neck or your jowl. And that's where a face and neck lift come in. And then if someone has a decent amount of fat, we're not going to try and use microneedling with radiofrequency to melt that fat. And we would do something more powerful like body tight, face tight, radiofrequency technology, or just straight liposuction.